Good evening, everyone. It's 7:30, so I think we should get started. I know we'll have a few people joining us shortly, but we've got a fairly packed agenda this evening, and I'd like to make sure that we stay on time. My name's Scott Fortnum. I'm the president and CEO of Children's Health Foundation, and I would like to welcome everyone this evening. It's an absolutely beautiful evening out there, a nice change of weather, and really appreciate you taking the time to join us. I would like to acknowledge the Anishinaabe, Haudenosaunee, Lenapewauk, and Anawandran peoples whose traditional lands Children's Hospital and Children's Health Research Institute sit upon today. Following that with just a few housekeeping items, before we get started, you'll see in the upper right-hand corner of your screen, we are recording this session for those who wanted to attend this evening but were unable, but also in case any of you wanted to go back and review particular sections, we'll make that available. There is a Q&A button on your Zoom screen that will allow you to post any questions you might have for our presenters, and we'll address those following the presentations. So Children's Health Foundation fundraises and raises money each year for a number of research priorities. And this is innovative research that is so important to our kids, both now and in the future. And there's world-class research taking place right here in London. When we look at the Children's Health Research Institute and Children's Hospital and our other partner, Thames Valley Children's Center, the pediatric research that takes place is absolutely amazing. And some of the outcomes are incredibly special. And that's only possible through donor funds, donations made to Children's Health Foundation. And in many cases, these gifts end up acting as seed money. They allow new initiatives to move forward or provide the beginning of an opportunity that allows Children's Health Research Institute researchers to secure even more funding. So there's a huge opportunity to leverage the support that we're able to generate. Tonight, my co-host is Dr. Craig Campbell, interim co-chair for the Department of Paediatrics, and he's also the head of the Division of Pediatric Neurology. Dr. Campbell's research institutes are in the areas of pediatric neuromuscular disease, and he's highly regarded for his collaborative leadership approach. And you know what, just an all-around good guy. So Craig, if you could please join me on screen.
Thanks, Scott. Really appreciate you having me here tonight, and good evening, everyone. It's great that you could all join us for an evening profiling some of our research that's happening in pediatrics and in this region. I think hopefully everyone understands and recognizes that, high quality research is really at the heart of good clinical care in our hospital settings and in our extended healthcare settings, and really as well drives the best practices for creating well-being for children and youth. And tonight, and hopefully over the next day or two, if you can join us for some of the other parts of this Child Health Research Day and linked to the Child Health Symposium, you're really going to see great examples of outstanding research. This research day for CHRI and the Department of Pediatrics has really, and Children's Hospital, has really become an important milestone in the academic year for our child health researchers and trainees. And several years ago, we came together to create a very large collaborative of many partners that contribute to showcasing the research over these days. And that includes the Children's Hospital, the Children's Health Research Institute, the Department of Pediatrics, pediatric surgery, pediatric psychiatry and mental health, Thames Valley Children's Center, the Faculty of Health Sciences at Western, the Developmental Disabilities Program, and the Graduate Specialization in Developmental Biology. So we're really happy to invite you in for a peek at some of the innovative research that's going on. We also know that you'll have the opportunity to join us for some of the events tomorrow, including some viewing of posters, as well as the keynote speaker, Dr. Daniel Kastner, who's a world-class scientist at the NIH involved in human genome medicine, as well as our evening speaker, who's Emma Lim, who's a London youth who's been involved in planetary health and global health, and will really challenge us and provoke us as scientists and citizens about the choices we make. So we're really looking forward to that and excited that you could join us.
Thank you, Craig. And thank you for bringing up the collaboration, because to me, that's one of the things that makes it's so powerful. The opportunities are tremendous, and it's wonderful to see everyone working together. Now, I understand there are over 75 abstracts and poster sessions to choose from to present tonight. Narrowing that down to the 4 we have, can you tell us a little bit about those choices?
Yeah, it was a hard choice. You're right, Scott. We've had 75 abstracts, many presentations. We have over 500 registrants for Child Health Research Day. So it's a big deal and a great opportunity for collaboration. But it made for some very hard choices in picking out what to showcase for people tonight. But what we have selected is a range of four presentations that give a range of various aspects of research, including health systems research, clinical intervention research, some social, cultural, and population health study, and then stem cell basic science research. And this is really a treat tonight, because we get to see this from really 4 of our highest caliber researchers right here in a setting where you can directly ask them questions and really help to digest the good work they're doing.
Well, there's certainly some significant breadth to the presentations, and that's wonderful. And having heard each of the speakers before, I think we're in for a real treat this evening. So thank you all. And Craig, I'll turn it over to you to introduce our first presenter, and just to remind everyone, if you do have any questions, either throughout the session or at the end, just post them in the Q&A, and we'll curate those and have them answered at the end of the presentations.
Great, thanks so much, Scott. So as Scott mentioned, I'm going to take you through 4 researchers and their presentations that they're making on studies they've submitted to profile at our research day. And the first scientist I'll ask to just come on screen is Dr. Levine Punai. Levine, you can get your camera on there, great, and in a minute, or actually you can share up your screen while I introduce you. Levine is a real homegrown gem for us here of a researcher, and I'm old enough now to remember him during his residency training program here and as a fellow in our pediatric emergency department. And really, he's grown and matured into one of our top clinician researchers. And he does this all the while doing emergency medicine. He works shifts, nights and weekends, and still runs a very active research agenda. He's the head of our pediatric emergency medicine research group, and he has a cross appointment to the Faculty of Epidemiology. And Levine has also taken national leadership on the research stage. He's a leader in the Canadian Pediatric Emergency Medicine research group called PERC. And Levine's going to talk to us about pain tonight. He's become a leading voice for pain in children as both a world-class pain researcher, but also a clinical innovator in managing pain. One of the more significant things he's done on the clinical side is bring the comfort promise to our hospital. And now we're one of a handful of North American children's hospitals who have this very innovative clinical program that really takes a systematic approach throughout our care areas in reducing pain. Navene's also leading a long-term cohort study of pain that's funded by Children's Health Foundation, which I think will really unlock a number of the answers, the unanswered questions still about pain complications and outcomes from children who experience painful procedures. Navene has a real commitment to comprehensiveness, and I've seen that in his work. He's like any great scientist, he just measures everything and he turns over every stone. And I think you're going to see that reflected in his work tonight. So Navene, can you give us a little bit of a rundown of your study, implementation of a quality improvement initiative to reduce pain and anxiety associated with needle-related procedures in a Canadian pediatric emergency department?
Sure, Craig, and thank you very much for all those nice things you said. It's my pleasure to be here tonight, and I do agree with Scott. It's a beautiful evening, so thank you very much for being with us. So the key word here on that title is quality improvement. It's a bit of a mouthful, but for those of you who are unaware or are not quite sure what that term means, basically what we do is we take research that people do and we try to find a way to implement it into practice or to change children's care for the better using research. And a lot of times research is done and we're not able to move it into practice, but this is one of the opportunities where we were. So basically when we look at pain for kids, most kids experience pain either because of a reason why they're coming in or because of procedures that we do to them. And most of these procedures are needle-related procedures. So if I could just draw your attention to the introduction here, needle-related procedures, they're very commonly performed in kids. And these are either IV pokes or venipunctures or lumbar punctures or vaccines. And children consistently rate needle-related procedures very distressing. And although we use topical anesthetic agents, it doesn't really get to the heart of the anxiety issue. And it's certainly, it's inconsistent. So we partnered with the children's group at the Minnesota Children's Hospital a couple of years ago to bring the Comfort Promise to London. And the Comfort Promise, as Craig said, it's been implemented at multiple US children's hospitals and a few hospitals in Canada as well. But we're very fortunate that we've been able to really run with it here. All the Comfort Promise is that it requires our nursing staff, or it asks our nursing staff to use 4 strategies. And these are common sense strategies. So topical anesthetic, positioning the child in a position of comfort, offering sucrose or breastfeeding, and distracting them with age-appropriate measures. So this project was, we wanted to evaluate the compliance with all 4 of these Comfort Promise strategies. So we implemented the Comfort Promise around March of 2020, right when we were getting to know COVID. And we collected data from a year prior, and then since implementation in March, and we followed all of the data right up until the end of 2020, and we're acquiring data for the first quarter of 2021 as we speak. In terms of our results, we're very excited with these results. They're preliminary results, certainly for the year of 2020, and we expect these numbers to go up. But when we look at topical anesthetic, before the Comfort Promise, we were only using these in 12% of children undergoing needle-related procedures. And once the Comfort Promise was implemented, that went up to almost 40%. We saw similar gains, although a much bigger gain in comfort positioning. Again, a 30% increase in sucrose and breastfeeding, and a 30% increase in the use of age-appropriate distraction. And we also look at things that could possibly mitigate against using this, and that's why there were no adverse drug reactions that we saw. So we concluded that the implementation of the Comfort Promise in a Canadian pediatric ED resulted in greater use of these strategies, particularly topical anesthetics, to reduce needle-related distress in children. The Comfort Promise is now extended beyond our ED to the inpatient units, and from there it will go on to the intensive care units, both for pediatric and neonatal, and then onto the pediatric care unit for postoperative care. So ongoing compliance, of course, will depend on consistent electronic recording. And we're not just doing this by ourselves. We're asking parents how they feel about the Comfort Promise as well. So we have parent audits happening in line with this so that we could get real feedback and real testimonials from parents to understand how this is affecting their children's care. So with that, I'm going to pass it back off to our hosts. And again, I really want to thank the Children's Health Foundation for making this type of research possible.
Great, thanks. Thanks so much, Naveen, and of course, thanks for your good work. I mean, this is just a slice of the many different studies that Naveen's looking at to impact pediatric pain. So we're very lucky to have him as part of our team here. The next researcher I'll invite onto the stage is Kathy Speechley. Kathy, if you can turn on your camera there. And again, please make sure you're typing in questions for Naveen in the chat or writing them down, so when we get to the discussion, you don't forget. I know we're going to go through a lot of information here, but we're very much looking forward to answering questions. So please keep track of those. Thanks, Kathy, for joining us tonight. It's a very special treat for me to introduce Kathy Speechley. She's works in epilepsy research, which of course is aligned with my role as the head of the Division of Neurology. And, Kathy, just want to tell you a little bit about Kathy. Kathy's an epidemiologist and a professor here in the Department of Paediatrics. She's also the leader of the clinical division of Children's Health Research Institute. So she leads the Children's Health and Therapeutics division. And really, Kathy is on so many of our departmental committees, such a leader in our department, and we all look to Kathy for guidance, not only in the research realm, but for so many of our processes in the department. Kathy's accomplished so much in her career, really through this commitment to understanding childhood epilepsy and its impact, not only on the child who's experiencing epilepsy, but the family and the family system that surrounds them. Kathy's been a foundational presence in our epilepsy research program, and now is mentoring and guiding a promising young group of epilepsy research in our department and at CHRI. This group is doing a broad range of epilepsy research work in addition to Kathy's research agenda, looking at various aspects of epilepsy diagnostics, epilepsy genetics, and the outcomes after epilepsy treatments, particularly surgery. And many of you, or some of you may know that we're one of 2 provincial epilepsy surgical centers of excellence in the province of Ontario, ourselves and Sick Kids in Toronto. And so Kathy guides a very active and busy epilepsy research agenda for our group. What's so impressive really in my mind about Kathy's work is her commitment to a patient population. And Kathy started out early in her career understanding the health-related quality of life aspects of epilepsy, and continued to follow that through over time, studying children and families further and further into their journey, their difficult journey often with epilepsy. And now to see her work inform an intervention trial using a novel mindfulness approach, I really feel is remarkable to see a researcher kind of complete this cycle of moving their knowledge into intervention. That's sort of the pinnacle that we strive for. And Dr. Speechley and her partner, Dr. Bax, in this study have not only done this remarkable work, but they've had to shift mid-pandemic in how they deliver their intervention. And of course, that was a challenging and dramatic scientific feat. And so, Kathy, I'll hand it over to you, and you can tell us a little bit about the Making Mindfulness Matter study and your experiences through COVID.
Thanks, Craig. Thanks for that generous introduction. I'm really pleased to be here tonight and have an opportunity to give you a little bit of an overview of our primary current work, which is a project called Making Mindfulness Matter in Epilepsy. And this is a project that I'm co-leading with Dr. Karen Bax, who is a clinical psychologist who actually created the Making Mindfulness Matter. So this is an example of a really neat collaboration among people working in different disciplines. And so I'll just tell you a little bit about how we got to this point of intervening with families in a way that we hope is going to make a difference in the quality of life of children living with epilepsy. So some of you may know that the disorder of epilepsy is quite common in children, but what you might not know is that up to 80% of children with epilepsy may also have a cognitive or mental health problem, and that about half of their parents may suffer from anxiety or major depression. So what we know is that current standard of care is not adequately addressing the emotional and behavioral problems of children with epilepsy. The care is focused primarily on trying to control the seizures that occur with epilepsy. So there's really a pressing need for a low cost and a scalable intervention to try to improve quality of life and mental health of these children living with epilepsy and their parents. What we know from our work over the last many years, as Craig was mentioning, slow and steady wins the race. I'm a demonstration of that in the work that we've done. We've put together some really important information that indicates that the family environment is a really key determinant of the level of quality of life and the mental health of children living with epilepsy. Our work has actually demonstrated that at times it's even more important than the actual characteristics of the epilepsy itself, such as type of seizure or the severity of the seizures. So putting all of these facts together based on our previous work, we decided that probably to intervene to support and help deal with the emotional and behavioral problems of children with epilepsy, the treatment might probably be best delivered in a group setting by community organization. And so that's what we set out to do with Making Mindfulness Matter. So what we have in this program is an 8-week concurrent program for parents and for children with epilepsy. And it offers a new approach to parenting in stressful situations. And it helps the children build skills to manage emotions and behavior and try to build caring relationships. And it's currently delivered as a video conference like we're having this evening, only actually more interactively, by non-clinician staff to groups of 4 to 8 people. Let me tell you a little bit more about this, why we're so excited to test how effective this program might be in aiding families of children with epilepsy. M3 explores how our brains work under stress, and it teaches a couple of very important concepts. Mindful awareness, which means paying attention to the current moment, to our thoughts, our feelings, our bodies, to others, and our surrounding environment. And it also teaches positive ways to respond using what's called social emotional learning. And this refers to abilities such as self-awareness, why we decide to do what we do, self-regulation, how we control our behavior, social awareness, being able to understand the needs and feelings of those around us and how our actions impact them. Positive relation skills, being able to empathize and get along well with others. So these abilities really help make better decisions about how we respond. And if you look on the center of the screen there, that figure, what we're trying to demonstrate here is that mindful awareness helps create a gap between our thoughts and our feelings and our response to those thoughts and feelings. So rather than having a snap, raw reaction when we have a particular thought or feeling, it's using a mindful moment to compose a response. So it's helping us make better decisions about how to respond. This is the kind of program, of course, that we could all benefit from. So where we are right now with this is that, as Craig mentioned, we modified the program. It was originally being delivered out in physical surroundings in community settings, in groups. But we've modified the program for live interactive online delivery. And we pre-tested that to make sure that we were conserving all of the key aspects of the program. And it seems to be working quite well. We're very pleased with the initial positive feedback we're receiving. So our recruitment is ongoing with a plan to be completed by the fall of 2022. So a year from this coming fall, we hope to have accumulated, to have about 100 people who've gone through the program. And at the end of that stage, we'll know whether it's feasible for us to do as we predicted, to be able to deliver this program effectively to families of children with epilepsy, and get preliminary information about whether it had an impact on the children's quality of life and their mental health and that of their parents. So I'll stop there. And I do want to thank the Children's Health Foundation for this opportunity to share a glimpse of our work with you.
Thanks so much, Kathy. And again, please mark down your questions for Kathy. We'll get a chance to talk to her in a little bit about her work. The next person, next researcher I'd like to invite is Dr. Jeanette Como. And Jeanette, if you can just start your video. Oh, there, great, there you are. And while I introduce you, please feel free to put your slide up. So Dr. Jeanette Como is a newer member to our research team. She's an assistant professor of sociology at King's College and an associate scientist at the Children's Health Research Institute. She's recently completed a postdoctoral fellowship at McMaster University at the Orford Center for Child Studies. And there she was a co-investigator on the Ontario Child Health Study. Dr. Como's program of research is closely linked to her personal objectives and commitment to improve the life prospects and mental health of disadvantaged children. As a population health researcher, she's seeking to understand mental health in children and reduce the inequalities and social and economic adversities that some of these children experience. She works to identify targets for prevention and intervention programs. She's a very passionate researcher, and I know you'll see this in her talk today. And while she's still early in her career, she's already making significant contributions in her field. So Jeanette, thanks for joining us tonight. I'll hand it over to you to explain the work that you're doing.
Great, thanks so much, Craig, for the introduction. I trust that everybody can see my slide. I think there was an issue in the beginning. Okay, great. So I'm really pleased to be here today to be discussing my team's research on children's mental health related emergency department visits in Ontario, which is a team of individuals from Children's Health Research Institute, as well as some of my colleagues at the Orford Center for Child Studies at McMaster University. So as Craig mentioned, my postdoctoral fellowship was on the 2014 Ontario Child Health Study. And so I've continued a lot of that research and expanded it after I got my appointment at the Children's Health Research Institute. And this study that I'm going to be talking about today very much is informed and motivated by findings from the 2014 Ontario Child Health Study, which indicated that 1 in 5 children have a mental disorder in Ontario. So things like emotional and behavioral problems. But among these children, less than a third receive specialized mental health care. So from a psychologist or a psychiatrist. There's also evidence showing that mental health related emergency department visits have increased by 89.1% between 2006 and 2017. Which is raising concerns that children with untreated mental disorders, so those who are not able to access services, may be seeking this much needed treatment and care in emergency departments. This is concerning because while emergency departments play a critical role during times of crisis, they're not designed to respond to children's mental health needs, their routine mental health care needs. And these children might leave the emergency department without adequate treatment and care plans, which could contribute to the severity of future pathology and impairment. The current research on children's mental health emergency department visits is limited to studies that use health administrative data. So this is the data that is collected in the emergency department, and it contains patient records, such as the reason for their mental health visit, but it contains very little information on the characteristics of children who visit the emergency department. This is the first Canadian study to supplement this type of health administrative data with a wide range of sociodemographic, behavioral, and clinical variables, which is made possible through a novel data linkage involving the 2014 Ontario Child Health Study and the National Ambulatory Care Reporting System, which is the health administrative data collected from emergency departments in Canada. What we did is identify children in the 2014 Ontario Child Health Study who had 1 or more emergency department visits for a mental health concern, then linked their patient records to their survey data so we could identify who they are. This is a seemingly simple research question, but it has tremendous policy relevance. If we have a better understanding of the sociodemographic, behavioral, and clinical variables that are associated with a mental health emergency department visit, then we can target preventative interventions at children with those characteristics. You can see the full results and conclusions from the study in our poster displayed at the Child Health Research Day. But I'd like to emphasize one of the key findings here this evening. What we discovered is that children exposed to social adversities, particularly those in low income, lone parent, and immigrant families, were more likely to have a mental health emergency department visit. And this was above and beyond their levels of mental health need. These findings suggest that mental health emergency department visits may represent inequalities in access to specialized mental health services and missed opportunities for prevention and early intervention. We believe this study provides policy relevant evidence with the potential to inform the planning and delivery of comprehensive child mental health services in Ontario and in our communities. Based on our results, early preventative interventions, and especially more mental health services, specialized mental health services, should be targeted at children in low income, lone parent, and immigrant families to minimize their suffering and the related healthcare burden. Again, thank you so much for your time. Thank you so much for making this type of research possible and for the opportunity to be here today to share it with you.
Great, thank you so much, Jeanette. Fascinating work and obviously really important work. So we'll move on. Again, Scott's out there collecting your questions. We'll move on to our fourth presenter, Dr. Dean Betts. Thanks, Dean, for for joining us tonight. While I go through your introduction, you can throw your slides up there. So Dean Betts did his early science degrees actually here at the University of Western Ontario before heading off to the University of Guelph to do his PhD. Following a postdoctoral fellowship in genetics at Case Western Reserve University in Cleveland, Ohio, he returned to Canada and ultimately moved his research lab here to Western in 2008. He's currently a full professor in the Department of Physiology and Pharmacology, Obstetrics and Gynecology, and Biology. He's a scientist at the Children's Health Research Institute, the Ontario Institute of Regenerative Medicine, and the Canadian Stem Cell Network. He's the current director of Western's Collaborative Graduate Specialization in Developmental Biology. And his research examines pre-implantation embryo development and pluripotent stem cell biology to try and uncover new knowledge to treat infertility and various children's diseases. He's an innovative and inspiring researcher. He's very forward-thinking and collaborative, and I'm sure you'll see those in his presentation today. He's going to talk to us about stem cell research, lactate and cell fate, a new approach to cellular reprogramming. Thanks for joining us tonight, Dean.
Great. Thank you, Craig. Thanks for the introduction. And thank you, everyone, for joining us this evening. And I look forward to some questions. This is a study, it's going to be presented tomorrow by our PhD student, Alex Kozlov, at tomorrow's Child Health Research Day as a poster. She presented a talk last year, and she presented a phenomenal job last year at the research day. But this study is co-led by a strong collaborator of mine, Dr. Robert Cumming in the Department of Biology. And Alex is our PhD student. So as Craig mentioned, I'm an embryologist and a stem cell biologist. And so I've been doing this for quite a while now, and always trying to add new technology to the research that we do. And I'm quite excited by the work that Alex has done. And so I'm just a messenger here. Alex and all the other trainees in my lab are the ones doing all the great work. I just get to look good based on their activities. But what she has done is quite amazing, and we look forward to some of the additional work that she has left in her PhD. And so I just want to give you a little bit of a background of just so you are up to speed on some of the stuff that we do. And so this project is centered around induced pluripotent stem cells. And so these are, you might have heard of these cells in the news. They've been around for now 15 years. It's Dr. Shinya Yamanaka from the Riken Institute in Japan discovered how to reprogram any specialized cells from our bodies, your bodies, my bodies, our pediatric patients, and convert them into a pluripotent stem cell. And so what he did, and I won't go through all the details of what he did, but it was quite amazing. And we do this in my lab now. And basically he found 4 factors, and these are 4 genes that are highly expressed in embryonic stem cells. So these are the stem cells derived from early embryos before they implant. And just expressing these 4 genes that are introduced into these somatic cells, they can convert, or what we call reprogram, these specialized cells. Could be beta cells from the pancreas, fibroblasts from your skin, any cell type, back into a induced pluripotent stem cell. So these induced pluripotent stem cells are very similar to embryonic stem cells. And why they're so powerful, and they've been talked about a lot in the news, is that the hope is that they can give rise to many therapies for many diseases and injuries that we currently don't have any adequate treatments for, especially for our pediatric patients. And the big benefit of these cells is one, these cells can have the ability to divide or make more copies of themselves indefinitely. So you can make as many cells as you need. And two, that they're pluripotent, meaning that they have many potential. And that many potential means they can become any specialized cell type of our bodies. So any of the 200 plus cell types that make up each and every one of us. And so depending on the disease or injury and the requirement for disease, you can make any cell type that you need for that therapy. And so some of the therapies are obviously transplantation based, but there's some other types of technologies that can be used for therapies from these cells, especially when you look at diseases that have a genetic mutation. And so a lot of pediatric diseases do have genetic mutations, but now through genome editing that you've heard in the news as well, and there's many different types of genome editing, and we do some of this in my lab. We can, if we know the genetic mutation, so for example, Duchenne's muscular dystrophy, and the dystrophin gene, it's mutated, we can use this technology to correct a mutation. And so you can genetically correct that iPS cell, or induced pluripotent stem cell, and create a specialized cell type for that disorder that could be transplanted back into the patient. So for Duchenne's, it would be a muscle cell or a muscle stem cell. And so obviously this is very exciting, and there are a couple of clinical trials ongoing in the world, one for macular degeneration and for spinal cord injury, and a few others as well. But these cells can be used for other purposes. And so you can also reprogram from any age-matched healthy individual. And any of these specialized cells, could be neurons, could be any cell type, can be compared to one another. And we do this in our lab and run a bunch of a battery of physiological and molecular analyses on these cells to identify any novel disease characteristics. And there's been many examples in the literature, different labs around the world using this technology to identify new traits of diseases that have been around for a long time. And if those characteristics are quantifiable, they can actually even be put through a high throughput drug screening tool. And this is obviously very exciting for drug companies, because they can make money off of it, but also I think it's low-hanging fruit, where actually a lot of the therapies will be coming through this kind of platform, where these cells can be put through in a high throughput manner, screen tens of thousands of new drugs to identify novel drug candidates that can be put into preclinical and clinical trials in a very cost-effective manner. So we don't do this in my lab. I would love to, but there are a few labs around the world, and obviously some pharmaceutical companies trying to do this for a number of adult, but also pediatric diseases as well. But the one roadblock with this technology is that this reprogramming process is very inefficient. And so typically, only 1 out of 10,000 cells that are exposed to these genetic factors for reprogramming become an iPS cell. And so it's a very extremely inefficient process, and the quality of the cells are in question when a process is inefficient. We can make these cells. They seem to be very similar to embryonic stem cells, but there are reports that they're not identical, and that there are some differences, and that cells, iPS stem cells from one individual is very functionally different from another individual, and even cells derived from the same individual can be very different. And so we wanted to learn or try to find ways to make this process more efficient. And by doing so, if you make a process more efficient, the quality of the cells, so the resultant stem cell will be at higher quality. And so we've gone back to, basic biology 101 and learning about metabolism even way back in high school. And that, most of our somatic cells, specialized cells in our body, generate energy through oxidative phosphorylation, through oxygen and through the mitochondria in our cells, through the electron transport chain. Whereas we know that stem cells, including induced pluripotent stem cells, generate energy and function through a process called glycolysis. And the end product of glycolysis, the waste product, is lactic acid or lactate. And we all know about lactic acid when we're working out and lactic acid builds up in our muscle. That's the end product of glycolysis. So our specialized cells in our muscle cells start producing energy by glycolysis because oxygen is not around in our muscles to do it through oxidative phosphorylation. And so we thought, well, what if we took that end product of glycolysis, the lactate or lactic acid, and treat our specialized cells with a brief exposure to lactate to see what it does to the reprogramming process. And Alex has found that it actually improves significantly the reprogramming process, and we get more induced pluripotent stem cells out through this reprogramming process. And by improving the efficiency of this technology, we believe we've improved the quality of the cells. Some of the early work that she's done looking at the mechanism of how lactate is doing this is actually lactate appears to be opening up the genome of these specialized cells, which actually allow these genetic factors, reprogramming factors to bind to the genome and turn on genes to help facilitate this reprogramming process. And so further work is trying to identify those genes that lactate opens up the genome. And so this is quite exciting, and it has big implications for not only the stem cell field, but other disease processes such as cancer, which actually a lot of cancer cells produce energy through glycolysis as well. But by producing better quality stem cells, we can produce better quality cells for cell transplantation, better cells for disease modeling, but also stem cells for drug screening as well. Thank you very much.
Great, thanks. Thanks so much, Dean. Really exciting work you're doing. Again, if maybe this time, I think Scott's going to join us back to facilitate the some of the question and answer questions that have come through.
Yes, thank you. But first, I have to say, doctors, thank you so much for your presentations. As a layperson, it was very interesting and intriguing. It makes me want to learn more. I guess I will start off. I do have a question, if I may. And I'm not sure if it's a fair question. I'm not sure who would like to take this on. But if someone were to ask you, why is this type of research important? What's the quick answer to that question?
Scott, should we invite everyone just to put their
yes, please,
their videos
up
here? Yeah, why don't we get everyone can join on here? Great, thanks everyone. So Jeanette, do you want to start and talk about talking to Scott's question?
Sure thing. Why is this research important? For me, the reason why I'm so passionate about my research, is because levels of child mental health need are really high in our province and in the country. It's the leading cause of disease burden among children. And of the children who are suffering from mental health problems, as I mentioned earlier, fewer than 1/3 are receiving specialized care. A lot of needless suffering is happening. And as a population health researcher, I believe that a lot of this is preventable. And so my objective as a researcher is to look at population trends and look at specific groups of the population to see if there can't be opportunities for prevention and intervention.
Great, thanks. Kathy?
Anyone else care to comment? Yeah.
So I'll speak to this a bit more generally about the importance of this research. I think what really excites me, and I see that here in London, we've made incredible advances over the years, and in the last decade, the last 5 years. is we have an incredible breadth of expertise across Department of Pediatrics and the Children's Health Research Institute and other groups in London that allows us to tackle the really gnarly problems that are so many associated with children's health. And I think that what I've really seen change is this degree of integration of the clinicians, the health providers providing the care, working with researchers and working across their disciplines. So we're putting a variety of expertise together, and that's where we really start to make the progress. And it's this kind of package that goes around a single health problem, because when you look at it, we understand that even the health conditions that we think we understand pretty well, it comes with a package that the child and the families need to deal with. And it's not going, the answers and the best care is not going to be provided by people working on their own. It's having this circle that goes around to create optimal care. And I think that I'm so proud of the way we can do this in London, that we truly have created a scenario where researchers and healthcare providers, the physicians and other healthcare providers work together so closely. And we start to see that we get to the answers much quicker, so that we're always in a situation where we're enhancing the care delivered to provide the best care available. And that's something that we can be so proud of occurring here in the region of Southwestern Ontario.
Thanks, Kathy. You can see why Kathy's such a good guide and mentor for our young faculty starting out in their research career. I don't know if Dean or Naveen, if either of you had a thought about sort of the contextualizing the impact of what you do.
Yeah, I'd like to, build on what Jeanette and Kathy have said, that, like Jeanette really hit on a problem that is growing in children, particularly in Southwestern Ontario. And Kathy talked a little bit about, having people come together in a collaborative sphere to make the research better and more impactful. And I think for me in the emergency department, I see this happening in real time. So, for me, like pediatric pain was very, very topical for me, because I saw it happening in real time, and I saw huge differences in how pediatric patients and pediatric care was delivered versus my adult colleagues just a few steps away on the adult side of the emergency department. So I think for me, every time I go to work, I see a need for how we can make things better. And at one point it's disheartening, because I say, oh no, I really want to be able to do this better. And I really want to be able to lessen that child's discomfort and their pain. But on the other hand, I'm very inspired by people like we have on this panel here, so who can collaborate and who can discuss and share our expertise, and how we can translate what we know and what we're learning about into practice, so that we can actually do the things on our wish list that we want to do, and to make care better for kids. And it's not going to happen in a week. It may not even happen in a month, but certainly it can happen over a short time period, like 1 to 2 years.
Great, thanks.
For me, I'll just add, I'm a part of a group of researchers in the Genetics and Development Division of CHRI. And, through I guess, initiative that started a few years ago, develop childhood models of disease. And so many pediatric patients come through with an obvious issues. And sometimes if they get their genome sequenced, it doesn't come back with a known mutation in a known gene for a particular disorder. And so we're trying to develop a system where we can identify novel mutations and through a high throughput manner, find if those new mutations are causative or not. And then we can develop animal models or cell models like I do, and learn more about the disease, so we can learn more about the disease, but also as a possible avenues for treatment for those diseases, either through stem cell therapy or as a drug screening tool. So it's quite exciting But one at a time. This is not it's not cheap.
Thank you all very much. It's incredibly inspiring, and my goodness, I'm so proud to know all of you, the amazing work that that you do. We do have a couple of specific questions in the Q&A. Kathy, the question is, how are the participants recruited for the mindfulness sessions, and do the sessions work better for specific age groups?
Thank you. Yes. So the way that we're recruiting families to the study is using our close collaboration with the clinicians, the physicians at Children's Hospital who are treating kids with epilepsy. They are actually members of the research team with us, with Dr. Bax and myself. And so they are approaching all families who are eligible who come for treatment at Children's Hospital. And we also have a neurologist, a community neurologist in Windsor, who's also affiliated with Western, who's recruiting patients from her her practice. And in terms of the ages, our study focuses on children between the ages of 4 and 10. And the reason for that is that this particular intervention has been developed with the developmental stages of children in mind, to focus in on teaching them about the way the brain works, gearing it to that particular stage of 4 to 10. And I think the beauty of this is that we're trying to create coping skills in children and their parents that will see them through the issues that they'll have to deal with going forward. So we start early. And I was wondering, first of all, when I heard about this, I was so excited. How do you get children as young as 4 to practice mindfulness? Like, I just envisioned a bunch of 4-year-olds, not being able to focus. But it's amazing. And Dr. Bacht explained to me that when she was working in schools with this program, and with children who've experienced considerable adversity in their lives, they're actually able to focus and calm down and be now in a regular classroom, but where before they couldn't be. So it's effective as young as 4. And when 10, they haven't left the planet yet, gone into adolescence. So it's a focused period of time. Now, people often ask us about, would this be applicable to other health conditions, other ages? And I think, yes, we're hoping it will be scalable, but we're starting with it as a defined population, and then we'll see where we go from there.
Great, thank you. We have just enough time for the one more question. I'm assuming this is directed towards Jeanette. Do you anticipate mental health issues escalating post-pandemic?
I think that's a difficult question to provide a concrete response to, so I'm hesitant to do that. But what we do know is that the conditions or the circumstances that are associated with child mental health problems have increased because of the pandemic. So parental unemployment, isolation, not being able to hang out with your friends, all these sorts of things that we know that are critical for child development and healthy mental health have increased. But I think I just wanted to touch upon one thing, is that the pandemic is providing an opportunity for a wealth of natural experiments to be happening. And there's all sorts of research, ongoing research right now on this topic. And one thing that I really appreciate about the Children's Health Research Institute is all of the opportunities I've had to collaborate for people. So over this event, Levine and I have connected over our mutual interests in emergency department visits for children. And Levine's going to be doing a study on the effects of school closures and social distancing on mental health related emergency departments among children. And I'm really excited to learn more about that, to see the findings and to contribute in any way that I can. So again, it's just such a wonderful opportunity for collaboration. And I can't thank all of you enough for the opportunity to be here.
Well, thank you very much. And certainly the theme of collaboration and partnership has been a common thread throughout the conversations tonight. And I think that's quite appropriate because for many of us, we don't have the knowledge, the skills, the labs, the ability to do the research that you are currently undertaking. But we as individuals, we want to have an impact. And by supporting Children's Health Foundation, we are in a sense able to have that impact. So I like to consider us as partners and collaborators as well, as I know you view us, and really want to thank you for that. Folks, it's been a wonderful evening. Really appreciate the time related to the discussion around some of the epilepsy discussions. There will be another event taking place on June 3rd, and the opportunity to learn about new epilepsy standards of care at Children's Hospital and how surgery is making a difference for drug-resistant patients. So stay tuned for more information on that. I think a number of you are already planning on attending, so look forward to that evening as well. And originally I did not think I was going to be able to make it, but I might be able to attend now. So we shall see. I hope so.
Good.
Any parting words? We're 1 minute over time, but I think that it was wonderful to hear your presentations tonight. Just wondering if anybody has any final thoughts before we sign off.
Well, Scott, I'd certainly like to thank my colleagues who I look to for inspiration and motivation in my own research journey, from people like this who have such passion for what they do and for the ultimate goal of improving the journey that kids are on who are struggling in various ways. So thank you to those to the four who have joined us tonight, and from my perspective, a huge thanks to the donors and potential donors out there who joined us for the evening. Really, so much of the research work that you will see here tonight and hopefully you'll join tomorrow comes through your generosity and your sharing of your resources to benefit children. So thank you so much.
Thank you all. And if we do have 1 more minute, I did miss a question that was buried in the chat. And again, to Kathy, if we take just another moment, is there still a high incidence of epilepsy with no known causes, despite batteries of testing and monitoring? And the question closes with thank you for your time and expertise.
Yes, sadly, there is a sizable proportion of cases of epilepsy for which the cause is not known. Lots of progress has been made, not in my area of expertise, but lots of good work being done on the causes of epilepsy and more effective treatment, but we still have no cure for epilepsy. And so families do go through a very challenging journey trying to sort out the type of epilepsy, the type of seizures, and landing on the most effective treatment. And that's why I was motivated to start this research in the beginning, was because of a conversation with Simon Levine, a pediatric neurologist who's just retired recently, who came to my office and said to me, I've come to realize that treating the seizures is not enough, and talked about the struggles that families go through. So while we're waiting for more effective treatments of epilepsy and more information about the causes of various types of epilepsy, we need to work to surround the families with the best support possible to improve their quality of life by offering a cadre of services along with the drug treatments and with surgery and other medical treatments.
Thank you, Dr. Speechley. And thank you, everyone. Thank you to our attendees. Thank you to the staff who put time and effort into organizing this evening. And a special thanks, of course, once again to our presenters. Your time and expertise is truly appreciated. And what can I say? Please keep up the great work. You're making an incredible difference, and it does not go unnoticed. So thank you.